So much we still don't know. For example, on Devin Kelly, the shooter here, that he left a mental health facility, escaped, more probably the case, back in 2012. Now, just the number of mental health facilities in that time have gone down close to 17%. And I'm leaving out psychiatric hospitals, mental hospitals that at their height in the 1950s in this country housed better than 500,000 American patients. That was then. Where are they now? That's the problem to psychotherapist Karen Ruskin. A lot of people, maybe dangerous people, are out on the streets. She joins us right now. Doctor, thank you for taking the time. What happened here?
Neil, this is so devastating. What concerns me so much is what's happening with mental health facilities. Why, oh why, are the numbers declining when we need an increase in mental health facilities? And not only are the numbers declining in terms of the mental health facilities, but then once you even get a bed and you get into the mental health facility, the numbers are so large that there's not enough beds for the people who are trying to get in, and the staff is overworked. This is so concerning. And then talk about not documenting. That's another potential problem. If you're not documenting violence, and even let's say you did document violence, are the other mental health care professionals then reviewing the file and reading it? Or does HIPAA violations prevent that? Or are they too overworked? There's not enough hours in the day to read the documents. All of these factors play a role.
You know, Doctor, what I'm worried about is back in the days of the 50s, early 60s, when state mental hospitals, psychiatric centers, whatever you want to call them, were at their height, and they housed better than 500,000 Americans, as I said. Where did all of those patients go?
Right. Good question. What's happened to them? So people who were in mental health facilities, where are they now? Are they in their own home? Are they dead? Are they doing things that are they in jails?
If we were keeping up with an audience that size, or a service public, then we have to ask. Now there are no such large options. Certainly, when it comes to psychiatric centers, or nearly the number that used to be. These mental health clinics that might have been, where we had Devin Kelly staying. There are so fewer of them that now, how do we judge who warrants staying at a facility like that? And how do we know who's dangerously left out of such a facility?
Right, and that is one of my concerns, because remember, we're judging based on patient report or on family report. If a family is concerned about a family member and they say, oh, I'm worried, let me bring my family member in. But what if the person is skilled at communicating and is deceptive about how volatile they really are? Or what if they do report that they're experiencing violent tendencies, but right now, I'm not going to act on that? The moment a patient says, I'm not going to act on that, then immediately the professional says, well, okay, how can I keep him? He or she isn't going to act on that. So the evaluation process needs to be reevaluated.
Doctor? How do we force it? Normally, if you were deemed to be a threat, not a jailable threat, like going to jail, but someone has committed you, back in the old days, to such a facility, there are fewer, if any, of these today, then how is it deemed? Who makes that decision to put you in such a facility if, in this case, someone like, Devin Kelly can just walk out?
Right. Well, you nailed it. There are some people that can commit. Psychiatrists, for an example, can commit. Mental health professionals can commit somebody. But remember, once you've now committed that person...
But are you committing based on the fact that they're a threat, or that they're a danger to themselves, or that they can't cut it on the outside?
Danger to themselves or others is a variable of why you can say, I am committing this person. Their length of time, though, sometimes there's an early discharge, which is also concerning because the person is no longer a threat. Presents as though they're stable. Stable? Stable for a day? Stable for a year? Stable for a few months? What? We have a problem on our hands, Neil. We really do.
All right, Doctor. Thank you very, very much.
Thank you.